How to get rid of cradle cap in toddlers. Cradle cap is a medical condition that causes crusty or oily and scaly patches on a baby's scalp. It is medically known as infantile seborrheic dermatitis. Although it is not itchy, it can cause thick white or yellow scales that are difficult to get rid of. The exact cause of cradle cap is unknown. However, there are a couple of factors that could be the culprits like hormones or yeast. Coconut oil. Coconut oil is widely used for its moisturizing, anti-inflammatory and antifungal properties. It moisturizes and softens the scaly scalp, reduces inflammation and fights microbial infections. Massage a little coconut oil gently into your baby's scalp, leave it on for 20 minutes before washing it off. Baking soda. The anti-inflammatory and neutralizing properties of baking soda help restore the natural pH of your baby's scalp. This in turn help reduce the flakiness. Baking soda also has antibacterial properties that eliminates any microbes present in the scalp. Tea tree oil. Tea tree oil is widely used for treating various skin ailments due to its anti-inflammatory and antimicrobial properties. The antifungal properties of tea tree oil eliminate the Malassezia species of fungi, which is one of the causes of cradle cap. Lemon juice. Lemon has anti-inflammatory, antimicrobial and bactericidal properties that can help in combating seborrheic dermatitis causing yeast and bacteria on the scalp. Mix a teaspoon of lemon juice with 2 teaspoons of coconut oil. Apply this mixture to your infant's scalp, leave it on for 15 to 20 minutes and then wash it off. Castor oil. Castor oil helps to seal in the moisture of your infant's scalp. This can keep it well moisturized and help in getting rid of cradle cap permanently. Apply a few drops of castor oil to your infant's scalp, massage gently and leave it on for an hour.